Welcome to the podcast where we discuss health, health span, lifespan, and longevity. I'm Dr. Noor Gajraj. Well, unfortunately, I've had an injury today. It's part of aging, and it's something that we're going to all have to overcome. So this is a really good opportunity to talk about Achilles tendon rupture. So it's Friday night. 3 hours ago, I was doing a little exercise with my wife. This was the exercise I was doing. You can see I'm running in place, but I think the critical event was running in place while leaning forward. That must have put a lot of stress on the Achilles tendon. Just a few things about Achilles tendon rupture. Who gets it? It's the weekend warrior. This injury is most famous for striking active adults who play sports sporadically rather than professionally. It is significantly more common in men than women. The ratio is often cited around 10 to 1. The peak incidence is between 30 and 50 years old. It typically happens in the watershed zone of the tendon, about 2 to 6 centimeters above the heel, where blood supply is naturally porous, making the tissue more prone to degeneration and snapping. Many patients report hearing a loud crack or pop, often comparing it to a gunshot or a branch snapping. The hallmark symptom is the sensation of being kicked or hit hard in the back of the calf, even though no one is there. There is usually sharp, immediate pain in the back of the ankle, though this can sometimes subside into a dull ache surprisingly quickly. And then I suddenly felt like a piece of wood had hit the back of my ankle. And I looked down, I think there was nothing there, it hadn't hit anything. And then I noticed there's this depression. See, this is the Achilles tendon. And then there's a drop off, right? That's the rest of the tendon. And right here, there's a depression. And it feels to me like it's ripped in half. Here's an interesting clinical sign, actually. This is called Thompson'S sign. Now, usually when you squeeze the calf, you'll see a little movement of the foot pointing downward, right? Oops, no, that was yeah. Now look at this side. And look at the foot. Absolutely nothing. Kind of distressing, actually. Anyway, I did speak to a colleague of mine. Luckily, I know Dr. Joseph McNutt. I've actually just come from the MRI center, and he's going to be reviewing the study, and we've talked about surgical repair next week, Wednesday. So, and my wife's been very nice to me. It's great to have a good partner. And do you have any comments about this evening? Quite stressful, right?
Yes, very.
That's it. Okay, so I am going to sign off, and probably next time you'll see me will be going into the operating room.